what I have to say is from the perspective of a physician who diagnoses and treats patients who have suspected or confirmed cognitive issues, and so you're obviously going to be getting a medical perspective on this issue here. What I'm going to do is just very briefly touch on what are some of the changes that occur in the aging brain, give a brief overview of dementia to make sure that we understand what we're talking about when we're talking about dementia versus aging, introduce the concept of brain maintenance, and again, I think this is going to be expanding on what Dr. Beatty introduced us a little bit, and try to go through some very practical lessons for brain maintenance, and then how we can apply those lessons during the current pandemic. So the aging brain, what happens to your brain as you age? So there are a number of changes that actually happen as part of normal aging, just like the visible part of your body that you can see changes with age, and you get a few extra wrinkles and maybe a few extra belt sizes and lose some hairs, and that happens to varying degrees to everyone. The same thing internally in the brain, there are some changes that happen to varying degrees in all of us. So there will be some shrinking of the brain, or what we term medically atrophy, that happens. This is not uniform in terms of how much it's apparent across all regions of the brain, and it happens due to changes in the brain cell shapes and connections, as well as the death of some of our brain cells themselves. And then there's changes in brain networks. So the connections that are made in the brain and how those connections function change over time as we age. So this is an example of a particular network in the brain that has been the subject of a lot of research in the last 20 years or so, called the default mode network, which is if you put a patient doing a psychological experiment in a functional scanner to try to understand what parts of their brain lights up when they do such and such a task. So what part of the brain lights up when they're talking or eating or whatever it is. The default mode network is actually the part of the brain that lights up when they're not doing anything. So it's the part of your brain, it's the network in your brain that's kind of ready and primed for you to jump and do something. And we can see that there are changes in the connectivity in that default mode network as we age. And so this is coming out of a lab in Iowa that's done some research on this. I'm not going to go into all the details. Here's some Canadian work in the same field. Cheryl Grady in Toronto did this work 15 years ago, where she and students in her labs showed that if you give participants tasks to do where they switch from the mode where their default mode network is engaged to some other network in their brain and back, the efficiency of engaging that default mode network changes over time. And so these are areas in the brain that as the default mode network engages, you see an increase in switch off, and areas in the brain where you see a decrease in switch off. So basically, what your brain looks like changes, and then we're at the point now where if we give people things to do in some functional scanners, what we can see in those functional scanners changes as well. And so the result of those changes is that our cognitive functions, so our ability to do things with our mind, also changes. And so certain functions, unfortunately, decrease as we age. Our focused attention, aspects of memory, so what we call working memory, how much information you can keep in your mind at the same time, and then also aspects of episodic memory, so remembering events and things like that, which is why many seniors speak about having seniors moments. And some aspects of complex problem solving, as can be measured in psychological tests, decrease over time. Certain functions continue to improve and seem to be resistant to these changes. So in fact, empathy and certain social skills, again, as measured by psychological experiments, and vocabulary, for example, if you don't have a problem with aging, such as dementia, then vocabulary should continue to increase as you age. And so this is just a summarizing many studies that have been done looking at this, and these are aspects of working memory, other aspects of memory, and then speed of processing is something I didn't mention on the previous slide, that decrease with age, whereas world knowledge, as measured by vocabulary, increases with age. And here is, if you look at how this can be measured by tasks of analytical reasoning, you see that over time, patients at different age groups had decreased performance on the analytical reasoning task, but they did better on the New York Times crossword puzzle, which is a measure of their vocabulary. Um, that being said, much like the changes I talked about earlier, the wrinkles, the loss of hair, whatever it would be, the external changes of aging, these changes that happen in your cognitive functions, there's a lot of variability. And so we actually see that there are some people who have, the changes that we expect to see. Some people decline more rapidly than the average, and then there's a proportion of people who seem to maintain most of their cognitive function despite age. And so there's research being done in super agers who don't get much worse with age. And so for those of you who don't know, this is Professor Brenda Milner, who celebrated her 102nd birthday this year at McGill University, where she still teaches. And she was a big reason why I got into this field, was listening to her lectures as a medical student. And she still supervises students and goes into the university every day. So she would clearly be in this category of super ages. On the other hand, we have people who are on that downward slope that I showed you, and then possibly dementia. And this is a contentious issue in that, does dementia really represent one of the extreme poles of aging, or is it really something separate than what happens in the aging process? And that would fill a whole talk just talking about what we think about that. But if I think of the perspective of somebody who might be in the audience today, I think common questions that people encounter as they age is, well, if I'm starting to have seniors moments or forgetfulness or some event, where am I along that spectrum of aging? And am I aging normally, or am I developing dementia? And even if I don't think I'm developing dementia, what can I do now to reduce the risk of developing dementia down the line? And of course, this question was already asked at the end of the last presentation. So I'll just give a very brief overview of what we talk about when we're talking about dementia, just so that we're all on the same page in terms of vocabulary. So the word dementia doesn't refer to a specific disease. It refers to kind of a syndrome or it's a description of what's happening to a person. And in the psychiatry textbooks now, the word dementia has been taken out, and it's now called major neurocognitive disorder. So if you're told by a clinician that you have major neurocognitive disorder, that would be synonymous with what we used to call dementia. So again, it's a descriptive label. It's not a specific disease. And one way to think of it is that there is an abnormal or accelerated, again, some debate, change in your brain structure and function that manifests as changes in your cognitive ability and a loss of day-to-day function. So not just a little slip up here and there, but something that's significant enough to impact your ability to function as you previously would. And it's associated with some presumed pathological change in the brain. So for example, the pathological changes of Alzheimer's disease or cerebrovascular disease, such as silent or even overt strokes. And then there's other pathologies associated with that. And I'm going to expand on that for a second, because it answers one of the questions that was asked earlier, is that sometimes we have a pretty good idea that we do have these associated pathological changes. In the cases of strokes, for example, we can do an MRI scan and we can say, oh gosh, this patient has had all these strokes that we see on the MRI, and the pattern of strokes really clearly explains the type of dementia they have, and therefore I'm very confident that this patient has a vascular dementia. But in some cases, we don't see the changes because the changes are microscopic. So the changes of Alzheimer's disease, by and large, outside of research settings, we cannot see those on scans that we have available in day-to-day clinical practice. And so we take the patient's symptoms and we say, well, I suspect that you have plaques and tangles of Alzheimer's disease, but I would only really know that if I took your brain and was able to see it under a microscope. Okay. And so the most common pathological changes that are associated with dementia are Alzheimer's disease, Parkinson's disease, and related disorders such as dementia with Lewy bodies, forms of frontotemporal degeneration, which includes frontotemporal dementia and primary progressive aphasia, vascular dementia, and then probably the most common is actually a mix of more than one of these two. And so there's some thought out there that degeneration begets degeneration. Many patients who are diagnosed with vascular dementia also have some of the plaques and tangles of Alzheimer's disease and vice versa, and there's also overlap between some of these other conditions. And so when we're talking about plaques and tangles, we're actually talking about something way back to 1906 when Dr. Alzheimer wrote his paper. He said, well, this is what a normal brain looked like. And then the autopsy of his patient, who he had described having this peculiar syndrome where she was losing her memory, he saw that the brain cells had this junk accumulated in, which he called neurofibrillary tangles, and then had these deposits of amyloid plaques around that were not normal. And now we know that the amyloid is a protein called beta amyloid, and the plaques are a protein called tau. So coming back to the question of superagers or even normal agers who don't develop dementia, that's a real question that is, you know, the Nobel Prize would go to somebody who can decipher this with certainty. Why doesn't everyone develop dementia? How come this gentleman at the age of 105 is still competitive running, whereas someone at the age of 65 may be unfortunate enough to develop dementia? And we only have partial answers to that, but there is a concept of what we call brain reserve. And so that is what you've got. So if you go for a race in a Ferrari versus a race in a Lada, it doesn't matter what kind of shape your Lada is. When you start off with the Ferrari, you are just given a much better chance to win the race. And so the brain reserve refers to factors that you didn't really have any control over, that you were born with, that may contribute to why you're less likely to develop dementia. On the other hand, cognitive reserve, which Professor Albert has described as individual differences in lifetime experience that modify the relationship between the brain pathology and cognitive performance, that's what you do to your brain over time to keep it in shape. So you could have two different cars, but if you don't take care of this one, this is what it'll end up looking like. And if you are immaculate with the care of your car, this is what you have at the end of 30 years. So brain reserve, roughly speaking, what you're born with. So things like the size of your brain, the number of neurons and neural connections. And both of these are probably influenced by genes, but there are other genes that influence brain reserve in other ways. And there are many factors that play into brain reserve that we don't yet understand. And cognitive reserve is what you do with it. And again, there's some factors that have come out as being known now to contribute to cognitive reserve. So what kind of education you have, what your vocational history is, what kind of hobbies and interests you partake in throughout the lifespan that will contribute to resiliency of your brain over time. Some interesting work has been done here in Canada looking at a contributor to cognitive reserve, in that bilingualism seems to be a factor that contributes to cognitive reserve. So in this study, they showed that people who were bilingual on average had a 5-year delay in their diagnosis of dementia compared to people who are monolingual. And that has since been reproduced in other settings. This was reproduced in Tunisia, I know for sure, in I believe it was parts of Russia, and this has been reproduced in other countries in the world. This finding is a fairly robust finding. So just speaking 2 languages throughout your life seems to give enough challenge to your brain to maintain it so that it may delay dementia. Music, in terms of how it is processed, has many factors that make you think of a language, and it does look like musical ability also is a factor that will help with cognitive reserve over time. And so here they were able to show that on various neuropsychological performances, seniors who were high activity musicians perform better than non-musicians, and these are obviously non-musical tasks. So those are some of the factors that lead to the cognitive reserve. And so if we go back to this study that I showed you, where they followed some people over time, and they realized that people were separating out into these groups where you had an average group that showed the average change in cognition over the lifespan, and then there was a group that seemed to maintain their cognitive function much better, whereas another group was declining a little bit more rapidly. They found that about a fifth of people were in this maintainer, and about 13% were in these rapid decliners. And then they were able to go in and look and see whether there were factors that could be teased out of this to say being a maintainer or being a decliner. One of them was actually sex, and for once, women have an advantage or given an advantage in the study in that female sex was a predictive of being a maintainer, whereas male sex was predictive of being a decliner. And then there was these gene variants that were found to be predictive of being in the group, but some of the factors that were identified were actually potentially modifiable risk factors. So whether you were higher education, living with someone, or had good levels of physical activity was predictive of being in the maintainer group, whereas if you were of lower education, this was predictive of being in the decliner group. And there's other factors that have been found in many other studies in the 8 years since this one was published. So this brings the concept of brain maintenance as an emerging concept, right? If you can't do much about what you're born with, but the factors that seem to be influenced over the lifespan, you may be able to take charge of those factors to maintain your brain as much as possible and reduce the risk of developing dementia down the line. And so, rather than waiting until you have dementia to worry about it, maybe we should all be looking in midlife but even as we enter our retirement years in ways of postponing senescent brain changes. And you can't go to a talk on this topic without seeing this slide. This is from the Lancet Commission report on the preventable risk factors for dementia. And this is the second version of this report. It was initially published in 2017 and was republished earlier this year. And these are the 12 factors that Dr. Beatty was talking about in her talk that have been shown to be contributors of developing the risk of dementia. And so this large analysis of hundreds and hundreds of other studies, the bottom line is that perhaps up to 40% of the risk of developing dementia is potentially modifiable. And so if we could make a dent in some of this risk, we could actually reduce the prevalence of dementia in the population. I do want to say that it's important to state that so far it looks like 60% of the risk may not be modifiable. And so if someone's unfortunate enough to develop dementia at any point in their life, you shouldn't necessarily view this as that they made poor lifestyle choices and that's why they have dementia. There's a lot of shaming that happens around medical diseases in popular culture, and we say, well, people who have diabetes should have just eaten better, and people who suffer from obesity should eat better, and so on. But the truth is often more complex than that, and certainly as individuals we should all focus on what can we do with this modifiable 40%, but not forget that some of it is just not modifiable at this point. But focusing on the 40%, what are the lessons that we've learned for brain maintenance? And so when I'm sitting with a patient during an appointment and they ask me, what can I do right now if I don't have dementia or if I'm worried about developing dementia to try to reduce the risk of developing dementia? And so, again, Dr. Beatty mentioned this, but I think this can't be repeated often enough. It's surprising that of all the risk factors highlighted in the Lancet Commission report, the biggest one numerically is hearing loss. And so there is definitely a relationship between hearing loss and dementia, and midlife hearing loss may constitute 8% of the total risk. Now, there's a lot of research that needs to be done still to find out if this is a cause or a symptom. And some of the smartest people looking at this think that it's probably a bit of both. So the hearing loss may, in some instances, and we don't know how many yet, actually be a marker of brain injury. So, hearing is a cognitive function, just the way remembering a list of words or being able to draw a clock is. We just don't always think of it that way. We kind of separate it as one of the senses versus some of the psychological functions. And so if you're starting to have trouble with some things like being able to recite a list of numbers and words and things like that, then it may be that the hearing loss is another symptom of that. But the hearing loss itself leads to social isolation. It makes everyday tasks more difficult. And so there's certainly a vicious cycle that can set in place if there is hearing loss. And so I think it is very important for people to address hearing loss if they have a concern about developing dementia. And I think this is particularly important during the pandemic, and I don't know why I put pandemics here, that we shift from to online and telephone lives where it's a little bit harder to hear in the first place. And so if you have some hearing loss, you may be excluded from the Zoom call with the grandkids or the telephone call to your neighbor that you would normally be able to see. Second lesson I'd like to make is that a healthy mind in a healthy body, this old adage seems to be true, and people are always interested in lifestyle and how that can impact on their risk of dementia when they have talks with me. The question is whether any specific supplements or vitamins or minerals might be helpful, and there's certainly some factors where we think that there are real reasons why these might help to protect the brain against neurodegeneration. But unfortunately, so far, none of them have been shown to actually yet be effective. So I can't point you to a clinical trial of omega-3 fatty acids showing that they do independently reduce your risk of developing Alzheimer's disease down the line. But if you want to look at what's been looked at, these are some of the factors here. There is a study with vitamin E in veterans who were also taking medication for Alzheimer's disease that did show some efficacy of that. So maybe vitamin E might be one of them. And at this conference, which is now 7 years old, and I don't think they've done a second version of it yet, or at least not one that I've seen, where they brought international experts in nutrition who were researching nutrition in the brain to come up with some common sense recommendations. The recommendations really did not focus on individual supplements. What they said is minimize your intake of saturated fats. Vegetables, legumes, fruits, and whole grains should replace meats and dairy products. So this is a lot of what we think of as a generally healthy diet and the Mediterranean diet that has been really touted. Vitamin E should come from foods rather than supplements. A reliable source of vitamin B12 should be part of your diet, and your vitamin B12 level should be checked regularly, because this is one of the supplements where if you are deficient in vitamin B12, then a supplement with vitamin B12 can make a real difference. If you have normal levels, the supplement is not going to do anything. Vitamin B12 is water soluble, so you'll just put it out in your urine. If you do use multivitamins, choose those without iron and copper, and consume iron supplements only when directed by your physician. This is this doesn't come up very strongly in many other recommendations, but there is a thought that excessive iron accumulation can be detrimental to your brain health, and then iron may compete with other nutrients for absorption, and so that's where things are. And this was already talked about, aluminum. I think we've pretty clearly proven that aluminum is not the cause of Alzheimer's disease, but this has been kept behind for people who say, well, until we can prove it for 100% sure, we should leave it as a recommendation. And that being said, it's very hard to prove anything with 100% certainty in terms of epidemiological relationships. And then, even though this was a consensus statement on nutrition, they added include aerobic exercise in your routine, recognizing that exercise was really complementary to diet. when they did a meta-analysis of 65 studies of people who already were diagnosed with mild cognitive impairment. So mild cognitive impairment means that there is a measurable change in your cognitive function that exceeds what we think of as the average curve for your age, and yet you have not yet developed dementia because the impairment is not severe enough to impact your day-to-day functioning. And so many people think that mild cognitive impairment in some individuals is a precursor stage to moving on to dementia. If you had mild cognitive impairment and you suffered from diabetes or prediabetes, your risk of progression to dementia increased. But on the other hand, if you were able to change your diet and follow the Mediterranean diet, the risk of progression to dementia decreased. So they were able to show that intervening on the diet can reduce the risk of progression to dementia. And as I mentioned in the most recent Lancet Commission, excessive alcohol intake has for the first time shown up as a risk factor for dementia. And so there is this Canada Brain Health Food Guide, which is available free of charge on the internet, and I think is a good resource for people who want practical tips in how to incorporate dietary changes that might help prevent against the development of dementia. And so the Brain Food Guide goes over certain foods that may be very helpful. And I would add that this brain health food guide is also a heart healthy food guide, and it's probably it's really an adaptation of the Canada Health Guide with some specific recommendations for things that have been particularly researched as being good for brain maintenance. And so the easiest way to find it is really just to go to your Google search bar and type in Canadian Brain Health Food Guide. It should be the first link that shows up. You don't need to log in or anything. You can just download it for free and print it up or look at it on your computer. So moving on from diet to exercise, which was mentioned previously as well. So I showed you this this picture here of the changes that were seen in the default mode network connectivity between young and old subjects. But the same group that was studying this was able to show that with daily aerobic exercise, with 12 months of activity, the connectivity was restored to the levels that they were seeing in inactive young adults. And so are these changes really the effects of aging, or are they the effects of our changes in activity over age? And that's an interesting thing to research for sure. And so the recommendations at this point are that aerobic exercise and resistive exercise both have independent positive contributors, and there's different studies I could show you for each of them. And so the recommendation would probably be to combine both of those, and even moderate activity is good. And so it doesn't mean that you have to join a cross-country club and go running every day for an hour to get the benefits of exercise. This is just showing you numerous studies and a meta-analysis of all of these studies that showed that yes, exercise reduces the risk of progression to Alzheimer's disease, or to dementia at least. I added these slides at the 11th hour because I went to a very interesting talk on Monday, or I saw a very interesting talk by Zoom by Ken Madden, who's a geriatrician at UBC who does research in exercise in the older age group. And one of the things Dr. Madden's found in his research is that sedentary behavior and exercise may actually be two sides of a coin that to a certain degree are separable. And he made this discovery when he did a study that got a lot of press in the Whistler Seniors Ski Club, which, as you can imagine, is a group of very active individuals who are not typical of the average senior citizen. These are people who are out, in the wintertime skiing, downhill skiing quite frequently, and in the summertime cycling, etc. But when they studied the amount of sedentary behavior, which means butt time, for lack of a better word, time that you spend not doing anything, the folks in the ski club were no better than the average person. And so it may be that reducing sedentary behavior is another target in addition to just saying get out and exercise. And the appeal of thinking about reducing sedentary behavior is that it's easier to convince people to reduce their sedentary behavior than it is to really sign someone up who doesn't exercise into daily exercise routine. I think both are good goals, but we shouldn't forget the simple tasks of reducing sedentary behavior. So in this pilot study that he did with graduate students in his lab, he looked at this whole plan that he had for changing sedentary behavior, and one of them included this movement makeover, which was to think about, well, what do I do in a typical day that involves sedentary behavior, and how could I change so that I accomplish the same task and yet reduce the amount of sedentary time I have? And so one example here was, well, instead of driving all the way to work, I'll walk 10 minutes to the location to meet the carpool, or I'll park 10 minutes away. At lunch, make sure you use the lunch hour to go for a walk around the block. During work, take the stairs at the office, use the standing desk, set a timer to get up every 30 to 40 minutes. And some of the work that he and his colleagues have been doing has really focused on this. Just getting a little bit of activity every 30 minutes seems to really have some beneficial effects. So these are things, I think, if we sit down and look at our day and say, gee, I do spend 2 hours in meetings, maybe I should make sure that I get up frequently for a little 30-minute break in between that to break it up. That would be a good way of reducing sedentary behavior. Not enough focus is put on the relationship between mental health and the risk of dementia. And there's numerous studies that have shown that people suffering from anxiety and depression in midlife and in late life have a greater risk of cognitive decline. And again, here, there's sometimes a cause and effect question, in that perhaps sometimes the development of depression and anxiety may be the early signs of progressing or of a dementia that's evolving. So whether treating the anxiety and the depression really changes your risk of dementia isn't completely known, but I would argue that that's not really all that important, because it would be important to help people take charge of their mental health regardless. And so if you know that on top of that there's a link with dementia, it may add a little bit more convincing to help you to take the mental health seriously. This study is really interesting, again, 5 or 6 years old now, but where they looked at just the association of developing dementia with cynical distrust. So there was a questionnaire that had been validated from psychological studies on cynicism, and when they administered that to seniors, they showed that the participants who had the highest levels of cynical distrust as measured by this questionnaire were more likely to develop dementia. And depending on which model they looked at, this was a 2-fold to 3-fold higher likelihood of developing dementia just from cynicism. And so when you see all the terrible things that are happening on the news and that you're seeing in your social media feed, it's important to take a break and step back from that cynicism if you want to put time on your side in terms of reducing the risk of developing dementia. Sixth lesson, this is something Dr. Beatty mentioned already, stay productive. This is a quite famous study. It's now almost 20 years old, and the data are 30 years old, but Scandinavia has a very good public health systems, much like we hope we have in Canada, where you can keep track of large groups of people because they're all taken care of by the single insurer, which is the state. And so they were able to look at a large group of people in Stockholm, and they had information on the amount of mental activity, social activity, and productive activity that they do over the week. And they could show that for all 3 categories, if you do social activity or productive activity on a daily basis, your odds of developing dementia are greatly reduced. So social activity is a little bit challenging right now, although I will come back to some examples of how we can do that during the pandemic. But productive activity can still happen even if you're not social, and so things like gardening or cooking or sewing, knitting, etc. So anything, and this may feed into the sedentary behavior that I was speaking about earlier. Keeping your mind active is really important, although I would say that as of right now, we don't know exactly what the best way to keep your mind active is. There's lots of companies now that have developed brain gym type games. You can get games on a Nintendo Game Boy. You can get computer games, websites that you log in that all claim to boost your brain power by, if you do these particular games every day, and you'll boost your brain power. And this fairly famous study now that is about 10 years old showed that unfortunately doing specific brain games did not seem to really make any improvement in cognitive function other than you got better at that game, but it wasn't generalizable into other cognitive functions. What they did is they got thousands of people who watched a very popular British TV show to sign up for this study, and some of the people were told to just exercise their brain in a non-specific way, so they were given interesting things to research on the internet and take notes on. Others were given very specific brain training exercises, and there was no difference between the two groups in terms of any improvements on any of the psychological tests that they were given online as well. So strategy computer games might even be better than brain training, and there's research being done in this area, but I think right now I would say there's no specific type of training to recommend. So read, but discuss the information that you read as well, because then you know that you're actually manipulating it and processing it and absorbing it. Learn a new language, pick up a musical instrument, attend webinars that are of interest to you. Anything that will keep your mind active is probably good, and it doesn't have to be one specific activity. Take care of your vascular risk factors. And so we, for years, have focused on heart health, and we know that things like high blood pressure, smoking, and diabetes are bad for your heart, and they're bad for your physical health, but we now know that they're bad for your cognitive health. And so we can see in that Lancet Commission report that hypertension, smoking, and diabetes contribute to the potentially modifiable portion of the risk of developing dementia. So I put this rhetorical question here. Did you know that smoking is bad for you? And I hope that most people on the webinar here know that. But now you can add dementia to the list of things that smoking contributes to, in addition to heart disease and stroke and cancer. And this fairly famous study out of Finland, the FINGER study, was published 5 years ago, where they tried to combine some of these factors. So they looked at supervised nutritional advice, supervised exercise, examination of those vascular risk factors, so making sure that patients' blood pressures and blood sugars were being monitored, and cognitive training. And they looked at patients who did not have cognitive impairment but may have been at risk of developing cognitive impairment because of a combination of their age and their family history and other medical issues that they had underlying. And the participants who took part in this intensive lifestyle examination had an improvement in cognitive scores over time as compared to the control group. And this was particularly apparent in aspects of executive functioning, which is kind of problem solving and your ability to sort things out in order, aspects of processing speed. And interestingly, it did not have as much of an effect on memory, even though memory is often what people will talk about. So there are other parts of your cognitive abilities that may improve with paying attention to your risk factors. Lesson 9 is getting a good night's sleep. This is a very interesting study where they could measure the amyloid protein. You remember that's that protein that deposits in Alzheimer's disease in the spinal fluid of patients, and show that the proportion of patients who had the amyloid below a certain threshold where we think that it indicates there's underlying Alzheimer's disease was far greater in participants who had decreased sleep efficiency. And again, here there's a chicken and an egg issue in that is the change in sleep pattern a symptom of the Alzheimer's disease that we had heretofore not recognized, or is it contributing to the Alzheimer's disease? But again, there's a relationship there, and so paying attention to that as a potential risk factor, I think, is something that's important. And the last one I would talk about, which isn't talked about in the Lancet report because it's not a risk factor, but it's really something you can do to tackle many of the risk factors, is meditation. So we can show changes in brain function in people who do as little as 8 weeks of regular meditation. And what they're showing here is on a glucose PET scan, which shows metabolic activity in the brain, you can see an increase in this important area in the frontal lobe over time in patients who have been able to meditate for 8 weeks. And there's lots of mechanisms that are suggested why meditation would be protective against Alzheimer's disease, and so some of them are direct effects on the brain. So it's a kind of brain exercise, effects on the mood, and we already talked about the relationship between mood and dementia, and effects on other risk factors. So you may be bringing your blood pressure down through meditation. Okay. So in the last 10 minutes, I'd just like to review those lessons and think about practical ways that we can apply these during our pandemic times. So I talked about checking your hearing. And so many businesses do offer free hearing screening even during the pandemic. And consider that the sense of hearing becomes even more important as activities shift online and by telephone. And I would say I totally understand that getting used to a hearing aid takes some time. Just like getting used to using a walker, if you need to do it, takes some time, or any adaptation that you don't have to. It's our human nature to resist it. So I'm hoping that just the information that this could help reduce the risk of Alzheimer's will convince those people whose hearing aids are in their drawer, or who haven't put new batteries in them, or who haven't taken the step to get their hearing checked to do so. I would say that most health-related businesses like optometrists and hearing clinics are all following regulations that have been put forward by WorkSafe BC during the pandemic. And so, I wouldn't use the pandemic as the only reason to put off looking at your hearing. This is a time where people are doing more and more cooking at home, and so this might be a time to look at your diet and think about, how can I change my diet to a more brain healthy diet? And so, like I said, if you just Google Canadian Brain Health Food Guide, you'll be able to download the food guide. If you're interested in an application of the food guide, this book, Mindful, is co-authored by Carol Greenwood, who is a researcher in the brain and nutrition, but Dr. Greenwood paired up with a dietitian, and also with several very well-known chefs from Toronto, and made recipes that incorporate the Canadian Brain Health Food Guide. So if you want to say, well, how do I go from these recommendations to actually trying something out, then you can do that. This book's available on paperback and just in e-format. And I have no financial stake in this, and no personal relationship with the authors, but I just applaud them for having had the guts to try this out. So I think it's a fun book to read on, and even just the information in the introduction is quite good. And if you are fortunate enough to maintain your income so that you can try out new recipes and cook at home, then donate to help those who cannot eat well, because there are many people who can't afford to take care of their health right now during the pandemic, and that's a real unfortunate secondary effect of the pandemic in terms of people who have lost their incomes and who have lost access to supports that they previously had. We talked about exercise, and so definitely it's shifting some of that exercise to outdoors. Combining cardiovascular and resistive exercise doesn't mean you have to go into the gym and lift weights, but you can give yourself a stretching routine. There are many kinesiologists who are offering online courses, and you can download boatfuls of videos on YouTube to get exercise routines that you can do at home. And remember that even modest exercise has benefits. So going out for a walk when it's quiet on the street, and we're just very fortunate in BC that even those of us who live in Vancouver are not that far away from open spaces and fresh air, and so there are opportunities for many people to try to exercise in safe ways during the pandemic. But even more, I think everyone can reduce their sedentary behavior. So just because you exercise doesn't mean you're not sedentary, and then just because you don't want to exercise doesn't mean you can't reduce your sedentary behavior. So look for incremental ways to increase your movement. Schedule regular movement breaks for you, even if you want to put a timer on your phone or your stove or whatever it is. If you have the opportunity to have a standing desk or to put your computer, your laptop up on a higher shelf so that you can stand to use the computer, because most of us are spending more time now on the computer during the pandemic. Put the channel changer on another piece of furniture so that if you want to change the channel, you have to get up and take it, and that's an incentive to move a little bit more regularly. And again, I'm just passing on the advice that I got from Dr. Madden, that to try not to sit for more than 30 minutes at a time. And of course, I've broken that rule for you by speaking for more than 30 minutes today, so I'm sorry. A healthy mind and a healthy mind. So, try to put away the social media if you find yourself getting stuck on that, and favor real-time chats with friends and family and phone calls. And even though in-person visits are reduced, there is help available if you're feeling anxious and depressed. And a good place to start is the BC division of the Canadian Mental Health Association, where there's a link to several tools, including some online tools. If you're just feeling mildly depressed or mildly anxious, and you don't think you want to look at medication or therapy, but you want some coaching to help you through it, there's some programs offered by the province that can help you through that. And then this website, bc211.ca, is a place where seniors can get connected to volunteers. And there's also family and friend support for caregivers. So if you're a caregiver who's feeling a bit burnt out during the pandemic, as many caregivers are, there are support services available through that resource. Staying productive and keeping your mind active. Dr. Beatty mentioned the wonderful Voices in Motion choir that was started by Professor Deborah Sheets at the University of Victoria. And the choir has shifted online during the pandemic, and I think they're having success as an online choir. And you can go and sign up for one of the choirs online at their website, voicesinmotionchoirs.org. So that's one example of an organization that you can look at. And you can use, again, if you're fortunate enough to have the means, you can use the pandemic as an opportunity to learn how to cook, so you won't just get the benefits of following the brain healthy diet, but you'll get the cognitive benefits of the activity of figuring out new recipes. You can use it as an opportunity to learn how to grow your own food. Maybe this is the time to follow a language course or pick up a musical instrument. And don't neglect your vascular risk factors just because of the pandemic. So do try to check your blood pressure if you have a cuff at home. If you have to go into the pharmacy, then maybe clean the cuff and check the cuff there. If there's someone in your family who can lend you one, just make sure that your blood pressure is under control, that you can check your blood sugar. And if you are a smoker and you think that now's the time to quit, there's good resources at quitnow.ca. Getting a good night's sleep is important, and so remember to do something relaxing for the last 90 minutes before sleep. Set a bedtime and a bedtime routine. Try not to look at screens when you're in bed. Use the bed for what it was meant for, and not for looking at a screen. Try not to take stimulants after lunch if you have trouble sleeping, and avoid alcohol in the evening if you have trouble sleeping. Make sure you're exposed to natural light every day. So even if you're a little bit concerned about the pandemic, go out for a very early morning walk, or so you get a little bit of natural light. And if you have symptoms about sleep apnea, such as snoring a lot or excessive sleepiness during the day, or waking up with headaches in your forehead in the beginning of the day, then maybe speaking to your physician about getting screened for sleep apnea would be a good idea. And then finally, I talked about meditation, and the best way to learn meditation is in a group course, which is of course challenging during a pandemic. But there are many apps online that offer meditation coaching. Many of them have a subscription model, but there are a few ones that are free. And there's so many that I don't really want to recommend one over another. But you can look at Oprah Winfrey had a list of top 10 apps, and I would say Oprah's list is a good place to start. And there's a couple that are free in there. There are online courses, so it's the next best thing to being in an in-person course is an online course. And this form of meditation, mindfulness-based stress reduction, was developed by Dr. Kabat-Zinn at the University of Massachusetts, and UMass does offer online MBSR courses. And there are reputable instructors who have even put free online courses in an effort to make meditation accessible to people. And I really like this site, PalooziMindfulness.com, where there is an online community that you can chat with for tips, and the clinician who has done this has made all of his courses available for free. So conclusion is that there are normal changes in our brain structure and function with age. And as I mentioned, dementia may represent an extreme of these changes that prevent normal function and is usually thought to be a separate disease. Up to 40% of the risk of developing dementia may be modifiable. So in order to address this, try to think of a brain maintenance program where you can address some of our 10 lessons. And some of those 10 lessons are definitely applicable despite the pandemic. And in some instances, the pandemic to some people may present even new opportunities. So these are apples from our garden that my wife has grown with love that will contribute to our brain health. So thank you very much.